introduce you to a new approach for treating pain called automated intramuscular stimulation, or A-IMS. This remarkable new procedure was developed by Dr. Anna D. Lee, a board-certified specialist in the field of physical medicine and rehabilitation. Dr. Lee has since successfully treated thousands of patients suffering from myofascial pain syndrome.
Hello, my name is Don Underwood. I'm a long-term patient and friend of Dr. Anna Lee. I currently teach and practice radiology in a large city hospital in Philadelphia. When I was young, working my way through college and medical school, I did a lot of construction work, which subsequently created a herniated disc. Years later, I underwent 2 surgeries, which were deemed successful, but I was left with incapacitating back spasm. Fortunately for me, I met Dr. Lee. She examined me, gave me a treatment. I received spectacular relief. My depression went away, my pain went away, and I continued to see Dr. Lee on a regular basis. Dr. Lee has certainly given me my life again, and I'm sure she can give you yours.
Dr. Anna Lee's first A-IMS treatment successfully relieved my pain that I had lived with for 23 years. In 1983, I was involved in a baseball accident that left me with 3 herniated discs in my neck. For years, I tried every type of treatment available to me, including chiropractic, acupuncture, massage therapy, disc fusion surgery, and pain medication. The disc fusion was between C5 and C6. 1 year after surgery and physical therapy, the pressure due to the rigid fusion further aggravated the discs C4, C5, and C6, C7. At the time of my first treatment, I was taking Ultram ER and Vicodin every day for pain. After the second treatment, I was able to eliminate all pain medication. Once the cycle of pain was broken, I steadily improved.
Now, before we talk further about A-IMS, it is important to understand a little about the pain cycle, which is experienced by many patients. To illustrate this pain cycle, let us use one common example. If a patient suffers an injury to the neck or back due to sports activities, motor vehicle accidents, or in a slip and fall accident, a person's head and neck are hyperextended, hyperflexed, and/or rotated as a result of this impact during the accident. As the neck and/or back hyperextends, hyperflexes, or rotates, the spinal nerve roots can be stretched, bruised, or compressed, resulting in spinal nerve root injury or radiculopathy. When this occurs, the result is spasms in those muscles where the nerves are innervated, making them short and tight. These muscle spasms put a traction effect on multiple nerve roots, thereby causing more nerve root irritation and more muscle spasms. When muscles are injured, excess chemicals called acetylcholine is released at the motor end plate zone, and this causes muscle to contract. The increased metabolic demand and ischemic condition in this zone result in an energy crisis and the release of additional chemicals that causes pain and more contraction of the muscle. Whether the injury is from nerve root irritation or from muscle injury, the end result is a vicious pain cycle. This self-perpetuating cycle is often the cause of so many myofascial pain syndromes that patients experience. Such injuries may cause patients to experience pain, numbness, tingling, and weakness in their neck, low back, arms, knees, and even in their hands and feet. These injuries also cause heaviness in legs, Charlie horse type of acute spasm pain. Restricted range motion can often follow in the neck, shoulder, knee, and back. In order to relieve these types of pain and sensory symptoms effectively, it is essential to break this pain cycle. The A-IMS procedure was focused on breaking the pain cycle by relieving muscle shortening. In this way, the treatment is regenerative, not merely temporary as most pain treatments are. This may seem similar to other procedures, such as trigger point injections or steroid injections. However, in A-IMS, no medication is injected. The traditional IMS procedure was improved further by incorporating local twitch responses by Dr. Lee. It was discovered that if a needle was placed into an area with irritated nerve fibers, the muscle would twitch spontaneously. These twitches simultaneously break the shortening of the muscle fibers and exercise the muscle. This permits the muscles to adequately relax so that the pain cycle can be broken and healing can occur. Recently, Shah and others of the National Institute of Health have shown experimentally that abnormal levels of chemicals that cause pain and muscle contraction are immediately corrected when local twitch responses, LTRs, are elicited. Note that A-IMS is much more effective in eliciting strong local twitch responses compared to the manual method. Clinical observation shows that the stronger the local twitch responses, the more relaxation of muscles occur. A-IMS was developed to automate the needling motion. Also, the treatment is aimed to maximize eliciting local twitch responses. By utilizing an automated device called an intramuscular stimulator to induce mechanical stimulation of the muscle with a needle, Dr. Lee was able to elicit more of these important twitch responses. This greatly increased the efficacy of the A-IMS procedure compared to the manual method. The following segment will address several frequently asked questions about A-IMS. Is A-IMS the same as acupuncture? No. A-IMS is a distinctly different treatment from acupuncture. A-IMS, unlike acupuncture, is a medical procedure that requires a medical examination. Also, in acupuncture, needles are superficially inserted into meridian lines defined by Chinese medicine. In A-IMS, needles are more deeply inserted into tight muscle bands that are palpable on physical examination. Finally, in acupuncture, unlike in A-IMS, there is also no twitch response elicited. Therefore, with acupuncture, there is no break in the vicious pain cycle mentioned earlier. Does the needle injure the skin or injure the muscle fibers? No. Unlike some needles, the needle used in A-IMS is not rigid and does not have a slanted, sharp, beveled edge. Instead, it is very thin, flexible, Teflon-coated, and has a rounded edge. As a result, it does not cut or injure the muscle's fibers. Also, the needles used during the A-IMS procedure are single-use sterile needles. Are there any side effects from A-IMS? The most common side effects are occasional bruising and post-treatment soreness in the muscles treated. Patients are glad to trade the painful tight spasm for temporary post-treatment soreness. Is the intramuscular stimulator, the device that automates the IMS procedure, FDA cleared? Yes. Dr. Lee's husband, Dr. Young Lee, who is an engineer, worked with Dr. Lee to optimize the design of the automated device. It was patented by Dr. Young Lee and has been reviewed by the U.S. Food and Drug Administration and cleared for marketing to treat patients with chronic and acute pain. Our FDA regulatory consultants have told us that as far as they can tell, this device was the first and only device of this kind cleared by the FDA for tension-type headaches of myofascial origin. How do I find out if A-IMS will help me? Most patients come to Dr. Lee's office as a result of persistent pain and/or sensory symptoms. The patient's injury history and thorough musculoskeletal physical examination will be used to determine how A-IMS can be most effectively used to alleviate a patient's symptoms. Most of the patients are pre-medicated to receive A-IMS treatment comfortably. Immediately following the A-IMS treatment, patients receive an application of hot packs to the areas that were treated. This reduces post-procedure soreness in the muscles. Finally, patients are given aquaphysiotherapy, in which they lie supine upon an aquamed bed, receiving massage to the treated areas with heated hydraulic water jets. This also works to reduce post-procedure soreness and promotes healing.
My name is Dr. Charles Dribbin. I'm a veterinarian. I'm 69 years old. I lead a very active life. I woke up one day with pain that radiated from my buttocks, or the lower part of my buttocks, down my right leg, through the hamstring muscles, down the lateral side of the tibia, down to the ankle. The ankle was what really, I think, hurt the most. My lumbar spine MRI showed a large disc herniation at L4-5 with 3 bulging discs. After receiving the A-IMS treatment, I've been pain-free for several years. I'm not limited in any way, I have not missed any work, and I feel fine, and I don't even have the slightest bit of a twinge. I would certainly recommend anyone with this type of pain to be evaluated by Dr. Lee before they allow anybody to do anything more radical.
Hi, I'm Lee Burgess, retired NFL player and a graduate of the University of Louisville. Having experienced major knee surgery and becoming acquainted with Anna and her husband Young Lee, and having learned about automated intramuscular stimulation, or A-IMS, I felt it was necessary to experience the therapeutic procedure for myself. Following my term as an athlete, I developed spinal stenosis, which caused constant low back pain with a numbness and tingling sensation running down my right leg into the sole of my foot. The pain prevented me from walking long distances. If I continued to walk, I might fall down due to the severe numbness in my right leg. So I overcame the fear of the treatment and decided to give the procedure a try. The day following the treatment, I walked 2 miles and did not have to stoop down to stretch my sacroiliac joint to continue to walk. My lower back pain is also considerably better. The experience was like a miracle. This treatment would be extremely beneficial to all professional athletes who are disabled and don't require surgery, and those athletes returning to the game subsequent to major surgery. The A-IMS treatment would enable the pro athletes return to the game sooner than expected and maintain a high level of performance. All athletes can benefit significantly with the assistance of the A-IMS treatment.
As you can see, A-IMS has been very successful in alleviating the pain symptoms of these patients. It has also been beneficial to countless more patients suffering from pain. If you are interested in learning more about A-IMS or have any questions from this presentation, please feel free to write to the address on your screen or simply call us. Thank you very much for watching.